All right, first and foremost, I want to say call her Loyam, La Yahweh, Bahashem, Yahweh Shai, Hamashiach. That's all praises to the Most High God and name His only begotten Son, who the world ignorantly calls Jesus Christ. Right? May the Heavenly Father, love and mercy truly endure forever for Israel and Israel only, as it says in the Holy Scriptures. Right? It's your brother Yerumia from the Sakari Philly set, back at it again to do this sit down. And what you're looking at right now, you're looking at Dirty Joe, right? Dirty Joe, and in this video he's talking about vaccines and distributing them, right? This video was published, I think, the end of last week, before he actually took the seat, which took place just a couple of days ago. So I'm gonna just go through this video real quick, and let's listen to where he say that the vaccines need to go. Where where these vaccinations should mainly go.
And in today's briefing, we discuss five things we'll do in an attempt to turn things around. 5 things to turn frustration into motivation. 5 things to help us meet our goal of 100 million shots by the end of our first 100 days in office. Some wonder if we're reaching too far for that goal. Is it achievable? It's a legitimate question to ask. Let me be clear. I'm convinced we can get it done. And this is a time to set big goals, to pursue them with courage and conviction, because the health of the nation is literally at stake. First, we will immediately work with states to open up vaccinations to more priority groups. The process of establishing priority groups is driven by science, but the problem is the implementation has been too rigid and confusing. If you were to ask most people today, they couldn't tell you who exactly is getting vaccinated. What they do know is there are tens of millions of doses of vaccine sitting unused in freezers around the country, while people who want and need the vaccine can't get it. We'll fix the problem by encouraging states to allow more people to get vaccinated beyond healthcare workers and move through those groups as quickly as they think we can. That includes anyone 65 years or older, a population that has accounted for over 80% of the deaths to date. 80% of the deaths to date. We also have to continue vaccinating frontline essential workers like educators, first responders, grocery store workers, etc. It won't mean that everyone in this group will get vaccinated immediately, as the supply is not where it needs to be. But it will mean that vaccines become available. As they become available, we'll reach more people who need them. We'll reach out and get the vaccine used. The second thing we're going to change, if we're getting more people vaccinated, then we need more vaccination sites. That's where we're going to harness the full resources of the federal government to establish thousands of community vaccination centers. On my first day in office, I'll instruct the Federal Emergency Management Agency, FEMA, to begin setting up the first of these centers. By the end of our first month in office, we'll have 100 federally supported centers across the nation that will ultimately vaccinate millions of people. Think of places that are convenient and accessible: school gymnasiums, sports stadiums, community centers. We've already had productive conversations with bipartisan groups of county officials, mayors, governors, tribal leaders, leaders of the private sector, who shared their ideas with us about this effort. And as we build them, we're going to make sure it's done equitably. We're going to make sure there are vaccination centers in communities hit hardest by the pandemic, in Black and Latino communities and rural communities as well.
Right. So you heard what he just said, right? So you could just rewind the video back, because this video seems to mess up every time I rewind it. So he just said that in low income areas, is where the vaccines need to be focused, on getting pushed at, right? He's literally saying that the main areas that we need to focus on pushing these vaccinations is blacks and Latinos, right? So we're not making it up, right? Israel is not Israelites is just bugged out, oh, everybody's picking on us, crying and little small violin. Like we're not making this up. Like we're not saying everybody is against us, because we're just, crazy and we're just imagining this, right? Everybody is just against us. It is just what it is, right? Everybody just is against us, right? Right. I've been actually going around and asking blacks and Hispanics, do you know anybody personally that's been affected, with having the COVID-19 virus, right? And everyone that I came across has said no, right? That they don't know anyone personally that has the virus, right? So it's kind of funny to hear him say that our communities are affected the most with this coronavirus, right? Yeah, I mean, when actually I'm in the community and nobody in the community is saying that they know anybody affected by it. So yeah, I mean, this is it's really just befuddling. It's just right, it's really just mind blowing. I mean, so I guess a lot of blacks and Hispanics, you can expect, to have schools, more than likely probably churches, and some other places where they actually start distributing this vaccine, right? Because like how you just heard Dirty Joe just say, right? Our communities are affected the most by it. So, we have to get it first and we have to get it, the most, right? It has to be pushed on us the most, right? Just like how we need our babies aborted because there's so much of us being born. So, our women need liberal rights to have, the choice, the freedom of choice to literally be a murderer, right? So, our communities are being affected the most by this virus. So says this white man, right? That we need the vaccine the most, more than any other area, right? More than Chinatown, more than the so-called upper echelon places, right? That white people can be, right? We need it the most, right? Right. So, I mean, blacks and Hispanics expect this, in your community. I mean, since Joe he just took the seat, right, like a couple of days ago. Expect this to be being pushed in your community, right? Um, um, coming soon, right?
Within the first month of our administration, we're going to deploy mobile clinics, moving from community to community, partner with community health centers and local primary care doctors to offer vaccines to hard hit and hard to reach communities in cities, small towns, and in rural communities. And to staff up these centers, we will mobilize thousands of clinical and non-clinical professionals. Think of the people that we deploy in natural disasters. Experts from the Federal Emergency Management Agency, from FEMA, and the Center of Disease Control, our Public Health Service Commission Corps, our military medical personnel, our first responders. Additionally, we're going to expand the pool of medical professionals, including retired healthcare workers, who can administer the vaccine and to ensure we have enough vaccinators to meet the nation's needs as we ramp this up. And as governors of both parties have asked, our administration will reimburse states 100% when their National Guard is deployed in the fight against COVID.
So you heard that he said that they will reimburse states and governments, like if National Guards, right, are dispersed for the help of pushing out vaccine. Like, why do you need a National Guard to help you push vaccine? And he's saying that, that states will be reimbursed, you know, for having National Guards push the vaccine, right? Using National Guards. Why do you need a National Guard, right? A National Guard is not a nurse. They're not a doctor. They don't. What do they know? What do a National Guard know about taking a syringe and having to put it into somebody's arm? What do they know about that, right? But this is for people that aren't willing to take it. That it seems that they're going to be setting up to be forcing it right on people, right? Blacks and Latinos is the main people that I'm worried about.
We'll provide resources for the cost of personnel, vaccinators, administrative staff, as well as supplies like dry ice and laptops and protective equipment. The third change we're going to make is we're going to fully activate the pharmacies across the country to get the vaccination into more arms as quickly as possible. Millions of Americans now turn to the local pharmacies every day for their medicines, flu shots, and much more. We're going to immediately start new major efforts, working directly with both independent and chain pharmacies to get Americans vaccinated. This program will expand beyond access in neighborhoods across the country, so that you can make an appointment and get your shot, conveniently show up at a particular time.
All right, so he just I've seen this video a couple times. He just basically going on with rhetoric. All right, anybody can easily look this up. It's on NBC, right? It's where it was I got this particular video from, but all the other stations pushed it. All right, so we see what he said. He said that National Guards is going to be used to help push these vaccinations, you know, on people, right? If need to be. And not only that, but he's saying that the government will help fund states that need the help of National Guards, you know, if they need that muscle power to help force it on people. And what people in particular? He already said it. He said that we need to hit these ghettos right where blacks and Latinos are, right? We can't make this up, right? Um all right, so let me get some scriptures. All right. The book of Isaiah, chapter 30 and verse 12. Wherefore, thus saith the Holy One of Israel, because ye despise this word. What word? The holy words of the scriptures, right? And trust in oppression. That's what our people do. We trust in our slave masters. And we trust in their hand, just like it says earlier in this chapter, right? We go down to Egypt, right? We trust in their hand instead of the Lord's. Right? We trust in oppression because trusting in the Lord comes with responsibility. You just can't be a chosen seed, right? You just can't be just be a child of the Lord and don't have got responsibilities. So this is why we rather trust in oppression. Why? Because Caesar says, "Come as thou art." So we don't got no responsibilities, right? Wherefore, thus saith the Holy One of Israel, because ye despise this word and trust in oppression and perverseness and stay thereon, right? And we try to stay thereon, right? Stay in the oppression, right? Because he allows us to be who we want to be, right? Which is a bunch of idolaters, right? And whoremongers, right? Book of Lamentations, chapter 4 and verse 17. As for us, our eyes have yet failed for our vain help, right? Joe Biden and all these presidents, right? All these nations, they're vain help. Right? America is vain help. In our watching, we have watched for a nation that cannot save us, right? And these nations cannot save us, right? Just as Martin Luther King, just as Malcolm X said, they can't save us. So, bottom line is, we have to, turn from their understandings and turn to the Lord. right? And sincerity and the truth, right? Hopefully, brothers and sisters were edified. Till next time, I say, shalom.